Okay, now I wanted to ask you about another book that you had wrote about ECT. If you could talk about that a little bit.
Absolutely. Well, ECT, for listeners who don't know, is short for electroconvulsive therapy, sometimes referred to colloquially as shock therapy, although most doctors who provide it don't like that name because they think it creates unnecessary fear. Um, After having done this work on Nigeria, I decided to turn my attention to my own society, the US society that I'm more familiar with, and grew up in. And the reason I got interested in electroconvulsive therapy, I can actually date the actual moment that I got interested in it. I was having a dinner party at my house, and people were talking about this issue of depression. At this time, uh, there was a lot of attention to Prozac, was relatively new. People were talking about Prozac a lot. And then somebody said something about um, electroconvulsive therapy. And everybody at the dinner party was talking about, oh, do they still do that? It's a horrible abuse. That's like torture or human rights violation. And then this one woman at the party, a friend of mine, said, oh, it saved my father's life. And everybody looked and said, really? That's so interesting. And so we asked her, and she said, yeah, he was in a very deep depression, and and I think he was suicidal. And I think if it hadn't been for the ECT, he would have killed himself. And this, I was so interested in this. And then as I started reading more and more about it, I started feeling like, how sometimes in science fiction and fantasy books, there'll be like two split realities. People are living in different realities. It seemed like you read some people on the subject and they're talking about this as a horrible form of medical abuse. And you read other people saying, oh, it's the most effective treatment in psychiatry, and it's relatively safe and we should be using it more. So I'm always attracted to ambiguities, and so I decided to do a deep dive into this subject. And what I found is that, in fact, we shouldn't think about it in such a polarized way, and that if you look at the history, it actually has been used as a form of abuse, and it does carry very serious risks. But on the other hand, it is an effective treatment that many people have benefited from. I think that the clinical literature, my own opinion, is that the clinical literature on electroconvulsive therapy understates the risks a bit. And I base that on the number of people who claim to have experienced memory loss from the treatment, which is a very serious side effect. People don't like to lose their memories. It's very hard to settle conclusively because sometimes people with serious mental illness can lose aspects of memory anyway from their illness. And there hasn't been enough long-term study to prove it. Nobody really knows, in my opinion, how common permanent memory loss is from ECT. But it's an adverse effect of the treatment. Everyone agrees there's some risk. It's just the degree of risk that's a matter of debate. And my argument for against people who would say, well, we should ban electroconvulsive therapy, it's inhumane, we shouldn't do it. My argument would be, well, first of all, it should, in the vast majority of cases, only be done voluntarily. There may be certain very small number of exceptions where people should have it involuntarily, but for the most part, it should be done voluntarily. And that, second of all, yes, there are risks of serious side effects, but there are risks of side effects with many illnesses and treatments. We don't give, and that's why we don't give them to healthy people. We don't give chemotherapy that's used for cancer to healthy people. We give it to people who have very serious cancer because that's the only way of getting them better. And they are going to experience adverse effects. And so I guess what I'm saying is that if the depression is serious enough and it hasn't, and other treatments haven't worked, ECT really should be considered. But what I try to do in the book is try to not just document the history, but try to show how it became so polarized, such a highly contested and debated thing. And I think part of the reason for that is the reality that it was in fact used in abusive ways in a number of settings. Psychiatrists who provide ECT are often very resentful of media representations like the movie One Flew Over the Cuckoo's Nest, because they think this exaggerates the risk, or it makes people afraid of the treatment. And they're right to a certain extent. I do some teaching of psychiatry residents at a local hospital sometimes. And even now, all these years after that movie, they tell me, when they mention the possibility of electroconvulsive therapy to their patients, the first thing they think of is One Flew Over the Cuckoo's Nest. But one thing I found was that the depiction of One Flew Over the Cuckoo's Nest, that depiction was not completely implausible. It may not be typical of how ECT is practiced now, but people remember these things. Another, I mean, I could go on and on about this, but one other aspect about electroconvulsive therapy that contributes to the stigma of the treatment and makes it so polarized is that it was one of the many forms of conversion therapy used on gay people at a time when gay people were considered to be having an illness. And this is well better known in gay communities than it is outside of them. But that's another reason why people, are understandably wary of the treatment.
Wow, wow. I appreciate you breaking that down. Yeah, One Flew Over the Cuckoo's Nest. That's a definitely a classic movie, man. I'm glad you brought that up.
Well, I actually, I've had to watch it many times for, for my work. I actually think in some ways it's less about psychiatry than about gender. It's a very misogynist movie in some ways. With the evil Nurse Ratched and the way the women in the movie, except for the prostitutes, the women in the movie basically serve to keep men down and don't allow men to experience their full freedom and enjoyment of life, which it's kind of a sexist message, in my opinion. The director of the movie actually was from Eastern Europe, and he intended it as a parable about communist totalitarianism. And so it wasn't really about psychiatry to him at all. The psychiatry was just a vehicle. But when I say that it wasn't completely unrealistic, the author of the novel on which the movie is based, Ken Kesey, he had actually spent time working in a mental hospital. So he'd been able to witness some of this. And actually, the representation of electroconvulsive therapy in the book is more ambiguous than the representation in the movie, because in the book, there is a character, a patient, who says, this treatment can be used in abusive ways, but it actually does help people, and people don't understand that. So, I mean, it's actually put into the voice of a patient in the book.
Yeah, yeah, media is powerful because that movie came out long before I was born. But like you say, it's people still to this day, when you think of, if they want to go get some type of treatment or help, that would be one of the first things that pop in their mind. They don't want to end up like that. But I can ask you, how, if it's done properly, how is ECT, how is it used on people? Do they have they have to take medicine, or do they have to go through treatments or therapy?
Well, if it's done correctly now, it's what's called modified ECT. I mean, they don't really call it that anymore. It was originally called modified ECT when these modifications came out in the 50s and 60s. But basically, you have to do two things to make it safe. You have to put the patient under general anesthesia so they don't experience the pain from the jolts of the electricity. And you also have to give them muscle relaxants, because the curative effect of electroconvulsive therapy is the convulsions. It mimics the epileptic seizures. And if you don't have the mimicking of the seizures, you don't get the therapeutic effect. In the early years of the treatment, this was not realized that you could use muscle relaxants. And so people were flailing about, and there was risk of broken bones and so forth. But if it's done properly now, that shouldn't happen. So normally what would happen now is, if you were recommended ECT, you'd get a course maybe twice a week for a few weeks. And if it's, in my opinion, probably best followed up with other treatments. That is, you shouldn't just get your ECT and then just walk out and assume you're fine. But it does bring very, very fast relief to people, including people who have been, you know, desperately ill and for a long time. And you know, this is important to mention because a lot of times some patients have been so depressed for so long that the only reason they're willing to try this treatment that scares them is that they're at a point in life where they feel like, what do I have to lose anyway? I don't myself think it should be a first line treatment for people, certainly not for people with mild depression. I think it should be really for people with severe depression when other treatments have failed. But I do think patients should be, you know, alerted in advance that there is a risk that they will lose memories, because if you're prepared for that and you're willing to take the risk, it makes a big difference than if you don't realize that going in.